Hello and welcome to the 2023 Virtual Summer School Series, Fostering Health and Wellbeing Across Extension. We're excited to have so many of you join us today. I am Cheryl Newberry, Program and Personnel Development Specialist with Oklahoma State University Extension. Today's session is focused on fostering healthy partnerships, and our panelists today are representing 3 states and Puerto Rico. Before we dive into our session, we just want to remind everyone about the Zoom Q&A feature we will be utilizing today. If you have questions you would like our presenters to answer, please post those in the Q&A box throughout the session. We'll try to answer as many of those questions as possible, and if the content relates to the topic we're addressing at the moment, we will probably insert those questions in at that time. So post your questions. And Brandy or Megan will be keeping track of our Q&A box. We also have 2 co-facilitators assisting us with our Q&A and chat today. You've met Brandy Bervin, University of Kentucky, who is monitoring the chat, and helping us in the Q&A box is Megan Franks with the LSU Ag Center. Thank you to both of you for helping us today. Health and well-being are areas in which Extension is well-versed in partnering with other agencies and organizations to create and deliver programming to clientele. Extension often has the research-based information, and partners often have clientele who need that information, but sometimes the opposite is true, as you will see with one of our examples today. Collaboration provides great strength in program development because of the expertise that each brings to the table. Today, we're going to hear about 4 such programs through a panel discussion with colleagues from Oregon, Puerto Rico, Texas, and Wisconsin. So let me introduce you to the panelists. First, we have Aurelia Mendez. She serves as the Workforce Development and Community Programs Manager at Oregon State University Center for Health Innovation. Aurelia is a certified community health worker, also known as CHW acronym, and has over 9 years of professional experience as a CHW in Oregon. She has experience facilitating and leading community health worker certification trainings, expanding community connections across the state, and she participates in an interdisciplinary team related to her work in community health. Dr. Evis Figueroa Sanchez holds her doctorate in public health and works as an associate professor for the Agricultural Extension Service, College of Agricultural Sciences at Mayagüez campus, University of Puerto Rico. Her main area of research involves health promotion and disease prevention and research on minority health issues. Dr. Rusty Holt has worked for Texas A&M AgriLife Extension Service for 18 years and currently is the director for Healthy Texas. She has worked in the area of health and wellness at the county level, where she created a county-based diabetes management, prevention, and awareness program. And Rusty has also led the development of employee wellness programs, implementation of a statewide family nutrition curriculum, and created a statewide holiday weight management program. Amber Canto is the director of the Health and Wellbeing Institute at the University of Wisconsin-Madison Division of Extension. She provides administrative and programmatic leadership for community-based health promotion programs across multiple issue areas such as food and nutrition security, chronic disease prevention, behavioral health, and health care access. Thank you to all of our panelists for joining us today. I'm looking forward to the conversation that we will be having. And to get us started, I would like for each of you to share just a brief overview about your particular partnership and program as it relates to Extension. So let's get started with Aurelia, and then Evis, Rusty, and Amber.
Great, thank you, Cheryl. We've had several programs with partnerships in the time that I've been with the OSU Center for Health Innovation, which is kind of like an arm of the Extension Service with the College of Public Health at Oregon State University. But I'm going to focus on one specific program. I have led the state-approved community health worker training program through our center since 2019. And this training program gives participants the opportunity and the foundation to learn about the roles of community health workers, as well as a range of topics relevant to the work of CHWs. All approved training programs must meet specific learning outcome requirements that are based by the state. And by the end, participants have a big picture understanding of working in community and public health and the ways that they can have a positive impact on individuals, families, communities and their health and well-being. Additionally, upon completion of our training program, participants will qualify for certification as community health workers at the state level through the Oregon Health Authority. So that's just a brief overview of the main program that I'll be focusing on today.
Great, thank you. Evis? Unmute your microphone. There you go.
Okay. Breast and cervical cancer represent important public health problems in Puerto Rico. Breast cancer is the leading cause of cancer deaths, where cervical cancer is the seventh most diagnosed cancer among Puerto Rican women. Despite policy interventions, screening rates for these conditions remain low. For these reasons, it's necessary to provide education to increase breast and cervical cancer screening in our female population. To accomplish this, the Puerto Rico Agricultural Extension Service partnered with the Puerto Rico Breast and Cervical Cancer Early Detection Program to develop a pilot project to help increase the number of women who use breast and cervical cancer screening service by raising awareness, providing education, addressing barriers, and motivated them to complete screening tests and follow-ups.
Great, thank you. Evis, Rusty.
Healthy South Texas is an initiative funded by the Texas Legislature, combining the expertise of the Texas A&M University Health Science Center with Texas A&M AgriLife Extension's one-of-a-kind statewide reach to promote preventative health at the most local level of a community. Our effort aims to reduce highest impact diseases and their consequences, including diabetes, throughout a 27-county area in South Texas. Healthy South Texas includes a comprehensive multidisciplinary team engaging families, enhancing education, and promoting behavior change across that 27-county region.
Amber, your work in Wisconsin has focused on coalition building to support health and well-being. Tell us a little bit more about your efforts.
Sure. Yeah. Thank you so much for the invitation to today's panel. And as you mentioned, I'll be talking sort of more broadly about some of our coalition work across the state. And really our Institute of the Health and Wellbeing here in Wisconsin has a strong commitment to advancing health equity. And this means that all individuals have opportunities to be as healthy as possible. To guide some of this work, we've outlined shared outcomes that center our commitment and really help focus our work across our health and wellbeing efforts on a number of different issue areas. One of those outcomes pertains specifically to mobilizing collective action via coalition spaces. And this is so that individuals and organizations who represent diverse sectors can work together on strategies that promote health and well-being, because coalitions can be a vehicle to advancing policy systems and environmental changes and building community capacity to address health challenges. I look forward to sharing a little bit more about that as we go through the conversation today.
Excellent. Okay. So I want to circle back to Aurelia right quick. Tell the group how Extension is engaged in the Community Health Workers Partnership. I want to make sure that they understand Extension's role.
Yeah, so I will share a little bit about this later on too, but our partnership with OSU Extension has been in place since the start of our training program since 2015. So we partner with OSU Extension faculty and staff to support our community health workers who are going through the training to know someone in the community that's already kind of embedded in the community to be able to partner with them already. So, you know, OSU Extension Service offers so many other programming opportunities, and community health workers have an opportunity there to connect with them and start building those partnerships and relationships with whatever agency or organization they may be working for. So sometimes that's clinics, Sometimes it's a hospital system, sometimes it's a nonprofit. And so directly making those connections already with OSU Extension Service has been a really key factor in us kind of having our graduates all across the state be able to have a connection right off the bat.
Great, thank you. So we know and value the importance of partnerships within communities. So what do you say is the biggest advantage for your particular program with regard to having that partner? Let's start with Evis, and then we'll go to Amber, Rusty, and Aurelia.
Our biggest advantage is that we increase our knowledge about cancer by receiving training from the experts. Also, we share information including educational materials, avoiding duplication efforts. And because of this partnership, we continue activities to improve health education within target communities. That includes urban communities and rural communities too.
Yeah, I think specifically with regards to coalitions, a major advantage is that opportunity to work in collaboration across a number of sectors, which can extend the number of available resources to really help address some complex problems. Of course, you also can diversify your perspectives and expertise, which can then enhance the likelihood of achieving community change or really helping to advance those health efforts. I think it's really important to think about the engagement of community members as well in these community coalition efforts, particularly those who are most impacted and impacted disproportionately with regards to poor health outcomes, because this helps ensure that the coalition activities are culturally appropriate and are really responsive to structural causes of health inequities.
Thanks. Rusty?
Well, there are a lot of advantages to the Healthy South Texas partnerships. And I think a key one is related to expanding the reach of extension health programs in South Texas. This partnership focuses on implementing programs across a large area of South Texas and within multiple communities. And because of the overall partnership, we've been able to expand the reach of extension health programs in communities that previously were not staffed in a way where we could provide these programs locally. So within AgriLife Extension, Healthy South Texas has allowed us to staff counties that previously did not have a family community health or family consumer science agent. And we've been able to staff those counties now with an extension agent for health. We've also built a team of extension program specialists who are experts in community health and nutrition. And these specialists are co-located in the counties of service, which is a change from how our specialist model previously worked. So prior to Healthy South Texas, most specialists who worked in health and nutrition were located about 3 to 6 hours from our service counties, making it difficult to always have specialist support in person in the county when an agent needed it.
That's quite an important change in philosophy in extension specialists and where they're placed. And that's exciting to hear that specialists are on the ground alongside educators to support programming in that way. Aurelia, what could you share with us?
Yeah, so as I started to mention a little bit earlier, OSU Extension Service has faculty and staff that are living and serving in every county in the state of Oregon. So these community-based workers have a deep understanding of the specific health issues of the community in which they are based, and have extensive networks already that they have built that include representatives of the health community. So the faculty and staff have also, as some of you probably have experience in this too, the skills in facilitation and education, partnership development, community change, and social and environmental or awareness of social and environmental determinants of health. And so the advantage there is that they can serve as a partner for community health workers. They've also helped us with hosting our live session days at one of the extension offices in each of the counties. And so there's that direct connection for a community health worker to partner with extension service faculty and staff, specifically in the rural and frontier areas of Oregon. I think that's where we see a little bit less of the like network or spread out network. So it's really great to have like a direct connection to each county.
It's very neat to see the model in Oregon in the reverse, where Extension is the support and the College of Health is the expert in delivering programming. And typically it's opposite in most other examples, and Extension being considered the educational outreach arm. So that's exciting to see a program work in a different way and engage Extension. So continuing with Aurelia, I want to ask you a question about funding. We know funding is necessary in order for some specific programs to be delivered. So tell us how you receive funding for your particular program in the community health workers.
Yeah, sure. So we are currently a self-funded program, and we have kept the program going through grant opportunities and gifts from coordinated care organizations. CCOs is what we know them as here in Oregon. Some of you may know them in other states as accountable care organizations, ACOs. So here in Oregon, one of our initial foundation partners was Eastern Oregon CCO, which is a network of all types of healthcare providers who kind of work in this network together for local communities to help with the healthcare coverage through Medicaid. So with the support of OSU Extension, we have a location to host those in-person trainings. And the faculty and staff have been willing to share their breadth of knowledge in the community. And so they've come in and kind of briefly introduce themselves, provide some information about the programming and some ways that they could partner with community health workers. So community health workers, some of them may be really new to the profession. And so even just having like an initial connection and examples of how their work may benefit communities is a great way for them to kind of get started. So we are working towards a more sustainable program, and with the growth in enrollment and additions of continuing education, as well as our reputation and our connections to OSU Extension and kind of getting the word out about our program, we may soon achieve that goal of being self-sustaining soon.
So what is the fee to enroll in the community health workers? Is there a fee for participants?
Yes. So because of our partnerships too, we've been able to more recently in the last 2 years offer some scholarship opportunities. So it kind of just depends. Specifically, they've been available for rural and frontier community health workers, but the enrollment without a scholarship is $1,200 and $800 for those who reside in rural and frontier areas with our Eastern Oregon partners. So it kind of varies and kind of depends on availability of scholarships too. So those partnerships are really, really important.
Okay, great. Thank you. How about Rusty, then Amber and Evis? Can you share some information about how your programs are funded?
Yeah, so a strong advantage of Healthy South Texas is that there are designated state legislative funds appropriated to support the programs locally, build that team, and develop resources. And so I mentioned previously how these funds have been critical to expanding our Extension Health team, but the funds also make it possible for each educator working on Healthy South Texas to have a support account that provides resources for local community programming based on what the local coalition and the local agents see as the need.
Great. Amber.
We have a number of different funding streams that support our programming, and across all of them, we've built in coalition efforts as a priority. So for example, we have some Centers for Disease Control funded work through the High Obesity Program. Coalition engagement and building coalition capacity is a core and central theme, building in staff time to convene that space, as well as resources to support the coalition meetings. We've taken a similar approach in supporting staff time through our SNAP-Ed. And also a new effort right now is we're currently working with our Wisconsin Department of Health Services on a maternal child health Title V block grant, in which we're partnering to build capacity around engagement of youth in local coalitions through local and tribal health department initiatives that are guiding and supporting adolescent well-being objectives.
Excellent. Evis.
Our partner, the Puerto Rico Breast and Cervical Cancer Early Detection Program, received funding from Centers for Disease Control and Prevention to continue and support the educational interventions and the collaboration with us.
Okay, great. I'm excited, Amber, that you're working in the area to engage youth in conversations around health and wellness. I think they are the future of where we're headed, and we need them on board. And I think it's exciting to have that audience engaged in your programming. So thanks for sharing that information with us. Okay, so Evis, let's go back to you. So you mentioned in conversations previously that it's so important to get information out to your underserved populations in Puerto Rico. So can you share a little bit more about how you are achieving that goal of reaching those underserved populations?
You mean about disseminating information?
Yes, ma'am.
Okay, well, we develop different educational materials such as posters, pamphlets that are more suitable for large group activities, but also we prepare additional materials such as videos, radio ads campaigns were used to disseminate information to the masses. These educational materials were designed for cancer-related education about healthy lifestyles, eliminate misconceptions and misunderstandings regarding screening, and to encourage women to use the program services from the Puerto Rico Breast and Cervical Cancer Early Detection Program.
Great, thank you. Let's talk about challenges. So every partnership probably encounters challenges of some sort that might be feel overwhelming or difficult to overcome, but Extension usually has a way to figure that out. So talk about the challenges that you may have faced as you work in partnership with others and how those challenges were overcome. And let's start with Amber, then we'll go to Rusty, Evis, and Aurelia.
Certainly challenges present at a number of different levels. And as I mentioned, sort of talking at a broad view across some of our statewide work and really prioritizing this work around collective action and coalition efforts most intently over the past 5 years, though this has been ongoing work beyond that as well. And one of the things we've heard from staff is a need to better understand coalition structures, modes of operation, sort of how they show up in these coalition and these collaborative spaces. So we've really been working through this challenge by committing to some capacity building efforts of our team across the state. And we've partnered with the UW-Madison School of Medicine and Public Health Population Health Institute to develop some trainings as well as a community of practice around coalition coaching strategies. And this helps our extension team members think about ways in which they can build more equitable coalition processes. And we're also currently in the process of trying to build out some additional training around sort of a coalition 101, if you will. And where we're hoping that this will go is that we will actually be able to integrate it into some of our onboarding systems so that as colleagues are joining Extension, we are establishing a baseline of understanding around the role that coalitions can play, Extension educator, or specialist engagement in coalitions, and how we can sort of all participate in that space in support of community health efforts.
Rusty?
Well, when establishing a partnership of any kind, whether it's a large initiative or an internal work group, I think there are some key strategies that help set you up for success. Early on, establishing leadership structures within the group to determine how decisions about funding, marketing, collecting data, things like that will be made is really important to help the group move forward when it comes time to make those decisions and move the process or the initiative forward. Also, assessing what each partner's expertise is can really help in determining roles and responsibilities of each partner. And then I think finally, being understanding that each partner group likely has some organizational norms that may be different from our own, related to how staff works or what the expectations of team members are and how they communicate those decisions. So being aware that some of those things exist and having a leadership structure in place to make those decisions, but then also being aware that even how we all work is going to be different. And so just being mindful of that as you encounter next steps that need to be made in the process or the program.
Thank you. Evis, how about challenges in your program and how you addressed?
Well, our major challenge happened during the implementation of the pilot project during the COVID-19 pandemic. The education and intervention program was originally designed for face-to-face interaction with the audience and at fairs and health fairs and other community gatherings. So we have to adapt the material to the restrictions and lockdown orders by COVID-19. We moved to virtual education. We delivered webinars, meetings, workshops, providing guidance to participants about healthy habits that help to reduce the risk of breast and cervical cancer and to avoid getting COVID-19. Additional challenge involves the sustainability of the program, how to continue the cancer educational program was the funding and collaborative efforts culminate. So that's the challenge that we found in our project.
Yeah, I think a lot of us had to transition in that way during COVID to online delivery, and we found that it's not such a bad thing, is it? That we are capable of doing online delivery or hybrid programming in today's world, and that sometimes we can reach more people with a hybrid program or a virtual program that we might not be able to reach. And so I'm in a way, this might seem or feel negative, but the COVID may have been the kickstart to a new delivery method for extension that can and very well has been successful. So thank you for sharing that. Aurelia, how about you? What about challenges within your partnership?
Thank you. Yeah, I would say that one of the biggest challenges for us was probably, or when I initially started leading the program, was building those relationships across the state, because I wasn't as connected as our extension partners. And so our extension partners have been great connectors, and they have helped us with recruitment and connections to other like health and social service systems in their particular counties. It has been really important that they are also understand the program, right? So some of them have been actually went through our training program to learn more about the community health worker model, and then also continue to support our programming through by either recruitment or even just providing information about upcoming trainings. So now that we have this kind of like positive relationship built through extension service and our other partners, we started to build this positive reputation, and we've grown our program. So when I first started in 2019, we were having these small cohorts of maybe 5 to 10 people in each cohort. And as you mentioned, Cheryl, this kind of the pandemic kind of gave us an opportunity to think outside the box and explore other opportunities for delivering programming. And so we did start to offer. We were the only program to be able to offer it completely remote once the pandemic happened here in the state, because we were set up through our online platforms. And so since 2019, our program has grown to now having full maxed out cohorts of 24, and we're really close to about 400 graduates in our program. So it's been significant growth there because of all the things that have occurred in our relationship and partnerships with Extension.
Very good. So there might be folks in the audience that might wonder, well, can people outside of Oregon take the community health workers course? Can you elaborate on that?
Yeah, so we don't have any restrictions on who enrolls into the training program. Anyone can complete the training program, especially if we do offer it remotely. We have started to go back to our in-person days, but I'm still offering some completely remote training. So if anyone is interested, they're more than welcome to sign up. The only thing will be that it may not be approved if you have a or like a health authority that approves certification for community health workers or traditional health workers. You may not receive that certification because we're only approved for the state of Oregon. So it would be more for you to learn more about the community health worker model.
Yeah, absolutely. I could see that course being of value to extension professionals, just to make yourself more aware and how you might engage with that particular group within your own community. So thank you for sharing that. That would be a great resource for extension people to check out. Okay, so Rusty mentioned briefly in a previous answer the importance of establishing roles and responsibilities for a collaborative program. So do you have other information or advice, Rusty, to add about how you went about establishing those roles within the Healthy South Texas program?
I do. Thanks for the opportunity to expand on that. So in Healthy South Texas, we use a shared leadership model where each partner has a designated point of contact who serves as the organization's leader for the initiative. So this means that being the leader for organizational activities relating to the initiative, but also serving cooperatively with the other partner's leader to guide the overall initiative. So I serve as the leader on the AgriLife Extension side, and I work with the A&M Health leader to establish roles and responsibilities based on partner expertise. So an example of this is embedding health screenings as a part of extension program evaluation. Prior to Healthy South Texas, extension programs were evaluated using participant pre and post self-report. However, we're just wrapping up a 2-year cycle where A&M Health has also provided participant health screenings that can be used to report those program impacts. And so A&M Health has an expertise in providing these screenings, and then AgriLife Extension has an expertise in delivering community-based prevention programs. And so by assessing that expertise, we were able to make decisions about the roles that each partner could provide. And this helps support that biometric data collection for program evaluation that we had not previously had as a piece of our extension programs. We also had our AgriLife research counterparts as a piece of the partnership, helping guide us through all of the research protocols in coordination with A&M Health for how that worked.
Like IRB and some of those kinds of things?
Yes.
Yes. Okay, good. Thank you. How about you, Amber? You mentioned in our conversations previously about utilizing an asset-based approach. Can you expand on that?
Yeah, and I think it kind of speaks a little bit to some of the things that Rusty was mentioning as well. And that's really sort of honoring and respecting we all have strengths, and we all sort of bring different perspectives and different strengths into a collaborative space. The same is absolutely true in coalitions. And so I think really thinking from the perspective of what sorts of strengths, resources, capacity one might bring to a partnership and to a collaborative space, such that we can elevate those assets and really build from a source of strength is really critical. And we do hear from our colleagues sometimes with regards, again, to sort of a coalition structure, it can be difficult to, or maybe challenging to navigate multiple different ways in which they might show up in a collaborative space. But taking the time to sort of sit down and reflect as a group and really clarify who's convening the meeting, who's facilitating the meeting, do we have an agenda, who's taking notes, what's our follow-up, right? Some of these like boring in some cases, or maybe really formal types of conversation can be really helpful for sustaining the success and the support of that sort of coalition or larger collaborative effort into the future.
Right. Aurelia or Evis, do either of you have anything to add to how you have established roles and responsibilities with your partners?
Well, based in our experience and in general terms, It is important to collaborate and partner with groups that have similar goals, objectives, and interests. Also establish a good communication system. The communication should be clear, should be honest, should be ongoing. It's important also to develop a formal partnership agreements, as Amber and Rusty said, with clearly defined roles and responsibilities. Develop a good or an engagement and action plans. And I think that it's pretty important too to building strong working relationships by maintaining a mutual trust and respect among partners. I think that's pretty important.
I agree with everything that has been said. I think the only thing that I would add is just in those partnerships, making sure that everyone is working like at their the top of their license is what we use for community health workers, but whatever it is, like just using what they already know or their skills in that relationship or partnership. So everything else, yeah, exactly right. It's really important to establish those relationships and maintain communication.
So Aurelia, along those same lines, you mentioned a term called beneficiary-centered team. So tell us what you mean by that.
Yeah. So this means that we put the priorities of those we serve first. So we hold ourselves accountable first and foremost for our beneficiaries, which are the people in the communities who are reached by our programs and services, and those most affected by the issues that we exist to address. So this is really important because we want to adequately address the needs and priorities of the people and communities we serve. And it doesn't just mean that we just, invite them to meetings or bring them to the room or the space, right? But making sure that they are actually at the head of the table and we help elevate their voices. So Beneficiary Center, I think we've been doing a lot of our programming based on this effort. So we do bring in, other community health workers that maybe want to provide input on our programmings, and not just through the community health worker training program, but we have other programs that we partner with Extension as well, that we really do bring in like community members as well to help us with some of the programming.
Great, thank you. Okay, Evis, let me go back to you. Tell us a little bit about how you plan to expand your program. Do you have intentions to address health needs for men?
Yes, in fact, in our pilot project, male family members as well, male partners and caregivers participated in the breast and cervical cancer education and intervention. Puerto Rican men were willing to support breast and cancer and cervical cancer prevention for their female partners and other female family members after being informed about breast and cervical cancer. And in the future, we're planning to educate Puerto Rican men in other types of cancer, such as colorectal and prostate, which are conditions of higher rates of mortality in our island.
Thank you. How about others? Aurelia, we'll start with you. What about expansion of your program? Then we'll go to Rusty and Amber.
Thank you. Yes, so right now I'm the only instructor for our training program. So we are hoping to expand and add more instructors to the training program. And then the other goal, hopefully in the next year or so, we want to add a Spanish language training opportunity for community health workers. So Promotores de Salud, that is one of the future expansions that we're hoping to be able to offer soon.
Great. Rusty, how about you?
Each year, we collect feedback through an assessment process with our educators, our regional program leaders, our partners, to look at what programming options we should expand. And so that's a yearly process that we conduct in coordination with program planning with agents. And so we're currently expanding the work plan for educators to have a broader selection of programs to choose from that they can implement as a part of Healthy South Texas. So this past year, that has has included adding mindfulness programs as well as strength training programs. And this current year, it'll include adding more options for youth nutrition and health programs across the span from pre-K through 12th grade.
Excellent. Amber.
Yeah, as I've mentioned, this sort of commitment to coalitions as a strategy and supporting community health is really a priority that we've established. And so we're continuing to identify ways to build capacity, sort of integrate those capacity building opportunities within our systems of support. I mean, I think part of that in supporting our colleagues and engaging in this work is supporting ways of evaluating and sort of telling the story of the impact of coalitions. And so that's work we're starting. It's not perfect. It's definitely a work in progress, but we know it's important to also demonstrate the value of that in a way that may look different than a sort of traditional, more direct education program, right? Where we can talk about discrete behavior change much more closely.
So stay tuned for tomorrow's webinar where we're going to talk about telling your health and wellness story. Last question that I have, and then if we have other questions that come into Q&A, we'll address those after this one. So bottom line, what are your impacts been? What do you feel has been your greatest success thus far with your particular program? Let's start with Rusty, then go to Amber, Aurelia, and Evis.
Thanks. Well, we have a number of impacts related to programmatic outcomes, participant reach that are really exciting to share, especially as they connect to adoption of healthy behaviors and economic impact. But I think some of our other great successes are related to organizational change that have happened since the Healthy South Texas initiative. And that includes, obviously, the expansion of staff, which I mentioned, development of new programs and resources for our educators in direct response to need from communities, a strong support for professionally developed marketing packages and program resources, and really a more vigorous evaluation system with a digital platform that allows for participant data to be entered in real time by participants or by educators, and then for educators and our specialist team to be able to see the impacts of those programs in a more real-time method.
Great. Amber?
Yeah, I think I'll maybe draw from sort of an organizational change success as well. And I think that's really sort of speaking to the integration and the movement around that prioritization of coalitions as a strategy. And in 2022, we did a survey of our colleagues statewide. 68 of our colleagues said that they were participating in roughly 100 local health coalitions around the state. About half of our staff had a formal leadership role in these coalitions, and those coalitions represented over 700 unique community partners from around the state. And so I think that speaks to sort of an important network of connections and opportunities for collective action. And while the scope and the breadth of those coalitions ranged, we did see sort of a broad reach across a number of different issue areas in advancing healthy food access initiatives, supporting mental health, substance use prevention, for example, and really helping identify community health needs assessment activities. So we're excited to see where the work goes.
Wow, that's amazing. We have a lot to learn about coalitions from Wisconsin. Thank you for sharing that. Aurelia.
Yes, thank you. Yeah, I think there's been several successes of the program, but I think the one that I'd like to highlight is initially the certification training programs were really based out of the Portland metro area. So a lot of our frontier and rural communities, were feeling left out. And so we really have focused on rural and frontier communities in getting certified community health workers through our training program. And so we have grown that network, and it's been great to be able to connect people and say, oh, I know someone in that county that could be very, very rural, to connect people to. And so it's been, I think that has been one of our greatest impacts, that we have expanded that network for our rural and frontier community health workers. And then, of course, growing the program too, because of that reputation and relationship with other communities and community health workers. they have, referred people to our training program, and this remote space makes it more accessible to those folks.
You shared a personal success story from a participant when we were practicing.
Oh yeah.
Can you share that with the group as well?
Yeah, sure. So we've had several community health workers go through our training program. Some of them, this is really, really new. So ours is, we call it a blended version because we offer some online, some in person, and then I actually introduced a few folks to Zoom back in 2019, where we had like 3 buttons at the bottom only, but now we have several. So they were really new to even just the online learning platform, and some of them, there was one in particular who we learn from each other. They share their experiences, what their goals are, what kind of programming they're looking into. Some of them are really hypothetical, but one in particular, she actually went out in the community and fully went forward with her project plan, and then was inspired by going through this initial training to continue her education, and received her bachelor's degree. I believe it was last year. So she even started a bachelor's degree program as well. So because she realized hey, I can do this. This was very helpful for me to learn about the online management program. And so it was really a success for us to be able to have them go through the College of Public Health and graduate with their bachelor's in public health. So, and I think also the other partnership, we shared a link about it too with the Coast to Forest project. Also really expanding the network of sharing and focusing on promoting and prevention of mental health and substance use disorders. So that has been another great kind of partnership overall with our rural and frontier communities.
Excellent. Thank you. Okay, Evis, I don't want to leave you out. Tell us about impacts from your Puerto Rico.
Well, in our pilot project, there was a significant increase in knowledge about breast and cervical cancer risk factors and prevention among women who participated in the educational intervention. And most women, around 95%, who reported not having gone through a mammography or a PET test recently, agreed to be contacted by the Puerto Rico Breast and Cervical Cancer Early Detection Program to perform a mammography or PET test.
Very good. So you are making an impact in reaching those individuals who haven't had that service before to get them engaged with the health service center. So thank you for sharing all of those pieces of information. I don't see any questions. Sorry, I'm here. There is a question. Let me read this to you. Extension professionals are very busy. How can employees identify ways to build partnerships or start engaging in this work without starting from scratch? Are there ways to collaboratively asset map or take inventory of existing work to tap into? And I will open the floor and let whoever has an answer to that respond.
I'll maybe get us started. How about that?
Okay.
I think that is very true with regards to how busy we are as extension professionals. And I also think that building strong, healthy, authentic relationships takes time. And there are few shortcuts, which is maybe not the answer that you were hoping to hear. And I guess I would just encourage folks to really think about building it in as just as important of a process in achieving our intended outcomes as the outcome itself. And, a way to maybe get started is to leverage your existing network. So this speaks a little bit maybe to the asset mapping piece of identifying folks who maybe you could connect with. I always encourage a one-on-one conversation, which is a community organizing tool. It's an opportunity to sit down, to listen, to learn about others' perspectives, their beliefs, their values, what brings them to the table, and maybe identified areas of shared interest. sometimes that leads to a next step. Sometimes that leads to a partnership. Sometimes it doesn't. And when it doesn't, you've got one more person to sort of, have in your connection toolbox. But I think it takes time, and it's, as I mentioned, just as important of a process as is the outcomes that we're looking to achieve.
Absolutely. Planning on the front end helps with outcomes on the end, right? Any other comments from any of the presenters on that particular question?
I'll just follow up to what Amber said on it being so important. I think we do know how busy all of us can be as extension professionals, but I think that I hope what we've all demonstrated as we've talked about our partnerships is how important they can be in helping you reach that impact. So making those connections with partners can really help you leverage your programs. So hopefully you can see that as a benefit. But I think it does take time. And I think that, some of the ways that you can get started are by, if you don't have a coalition, looking at how you can start a local coalition and bring those community partners in. So where even if you're not collaboratively working towards one program or one event, you're all coming together to share what you're doing and communicate about those resources and each promote and talk about your programs. And perhaps then you can start to find synergy among those, and those can help develop those partnerships as well.
And I'll add too that sometimes partnerships or coalitions are already established within community, and perhaps it's a new educator coming into a community, and they can join a coalition that's already established to learn what they're doing and see how Extension might contribute to that particular coalition. So look for opportunities to join something that's already established to make Extension a part of that team. Great. I am so thankful for all four of you for joining us today for this panel discussion. I feel like your programs are each unique and have really contributed to improving health and wellness in your particular states. And thank you for sharing your expertise in this particular area. And I will get us wrapped up for today. So again, I want to thank our panelists for sharing today, and thank everyone who attended virtual summer school today. If you would like to contact our presenters, their contact information is posted in the chat for you, and it will also be added to the NAEPSDP webinar archive page. We'll also be placing the recording of this webinar on that particular site as well. We would also appreciate any feedback on today's session, and there are several ways that you can provide feedback on the survey. You can follow the link that is being shared in chat, or you can use your phone and scan the QR code that you see on your screen. Or when you close your webinar, a screen will pop up and ask you to complete the survey as well. So there's 3 different ways that you can respond. So as we close, I want to invite you to join us tomorrow for our final session, and our presenters will be from the Kaiser Permanente Washington Health Research Institute and APLU, and we will be discussing telling our health and well-being story. Thank you again to our presenters, facilitators, and everyone in attendance, and I hope that you have a wonderful day, and see you tomorrow.